Tell us about that patient. I believe he was the 35-year-old diagnosed in Seattle.
Well, he's an important patient to know a lot about because he was someone who actually came from China, self-diagnosed himself that something was wrong, so we were able to care for him in a safe way. What was important in his case, which was written up in the New England Journal already, is that he was the first case where we used a biologic agent, remdesivir, which turned around his case dramatically. He had gotten very, very sick, and we were able really to recover him, and he did incredibly well after that. So he's interesting from a standpoint of a lot of different reasons.
So are you suggesting that remdesivir will be effective as we continue to see these case numbers climb across the country?
Well, as you know, it's one case, but at least the research seems to be very, very positive. And it's used for those cases where a patient is severely ill. So they're able to use it in Washington now for cases that are severely ill, and it seems to be effective. So at least it is a bright spot that's out there.
What about the hospital system in this country in general? I believe we have 95,000 intensive care unit beds. I mean, are we braced for something of this scale?
The good news is that hospitals have been ready for this a few times. You know, we've been through this with Ebola, with H1N1. So a lot of the protocols and things that we need are in place across the hospitals across the United States. Each morning at 7:30, we get our 51 hospitals on the phone, and we go through all the things that we need. I think if you asked me what hospitals need the most, it's testing, testing, testing. We've got to make sure that we have the protective equipment for our caregivers and for our patients. And then what we're worried most about is, are we going to have enough caregivers to make sure we can take care of everyone? That's why their health and their wellness is critical. But we're already looking at how we use our ICU beds, how can we use alternative areas of care, including setting up tents outside of our hospitals. So we're already going through the process of looking where we have capacity, what we need to do, and what do we have to do in front of it. So we're trying to stay way in front of this as we see a wave of patients potentially coming forward.
And what do you tell healthcare workers, Doctor? I know there are a number of people who are looking at the risk that they face and at least noting what is not great data at this point to draw from, but seeing that there's a fairly high transmission rate amongst healthcare workers or to healthcare workers.
Right. What we try to do is we know how to protect healthcare workers. You know, we've done this with Ebola and with other transmissible diseases. So we're pretty comfortable with that. So those kind of procedures are there, but we have to make sure that we have the proper amount of equipment, the masks, the face shields, all of those things in place, and make sure that we also have the equipment to protect the folks that are cleaning the rooms and all of the other ancillary professionals that we have. So we're comfortable that we know how to do that part of it.
So Politico has a pretty disturbing piece out today where the CDC essentially confirms that there is the shortage of supplies needed to extract the genetic material from the virus in order to test patients, the mRNA. How is this happening in a country like the U.S.?
Well, I think those are the big wake-up calls. I think if I had first on my wish list would have been that we were stockpiling kits and we were ready 3 months ago. We can't go back in time, but I think that's what everyone would have wished for, because other countries like Korea, Italy, and in China have been at this for a while. So those reagents that we use to extract RNA from the samples have been used up in other places. So those are the types of things that go into the testing, and it's a little bit more complicated than people think. But all of those things that we need in the supply chain have to be there in order to be able to do the tests adequately. I'd say that's the biggest struggle that we have. The more people we can test, the more we'll know about how this virus spreads.
On that point, there's reports that Chuck Schumer is going to, and the Democrats are going to call for a national state of emergency that would allow FEMA to use $40 billion in disaster relief funds. Is this something that money can help solve, or is it more about the sheer lack of supply and the lost time, as you mentioned?
I think it's both. I think the money's going to help as we go through it. You know, we're concerned about some of our caregivers. Do they have the support at home? One of the things we worry about is if schools are closed, a lot of those nurses and doctors have children that are in school. So how do we work to ensure that we have enough people? On the supply side, we're just going to have to ramp up. I think the lesson for the country is next time around, we better have a supply chain that exists somewhere within our borders so that when something like this happens, we ensure that Americans have an adequate supply within the borders of the United States to care for our own people.
So just give us an update, Dr. Hochman. You have 51 hospitals, 1,085 clinics, according to your website, many of them in the West Coast where we've seen a lot of cases in this country. How many tests right now can you give per day?
Not enough, not even close to enough. You know, we still have people that, you know, have tested. This morning we're hearing about the Kirkland firefighters that are in quarantine. They have not been adequately tested yet. So the turnaround time is an issue. We're starting to do what we're hopeful is that with the commercial labs now coming online, that'll make a significant difference. But right now, I would say it's woefully inadequate in terms of our ability to be able to test readily, quickly, and get a turnaround time that makes sense.
And that's because of the federal government.
I don't think it's just the federal government. I think it's really about, you know, getting everyone online quickly enough. You know, this is, it's unprecedented. I think there are a lot of factors in the whole chain of how you do testing. But it's also getting the commercial labs, and it's making sure that we've got the reagents. As you talked about, extracting the RNA and doing all those types of things, those are the things that we really, really need. So we need a full court effort to ensure that we have the testing available, and it's probably in a whole bunch of different areas, both on the commercial side. We have a lot of universities that are doing a lot of the testing now, as well as with the CDC and the federal government.